is Sana Ramal, and today I'm going to be presenting on Orleans County, Vermont, and my program, my obesity prevention program in this area. So Vermont's county, Orleans County as a community, is smaller. It has one of the highest poverty rates in the state, so it's not doing as well as the other counties, the surrounding counties, meaning that it hasn't contributed to the health reputation that Vermont has. Most people are of white descent. The median household income is a lot lower than the surrounding counties, 49,168, and it has a poverty rate that is higher than the surrounding counties. So it's not keeping up with the counties around it, and because of these reasons, these socioeconomic reasons, the nutrition status and the nutrition status has suffered in Orleans County and for the residents. So residents haven't been able to buy the food that they need to maintain their physical health. They haven't been able to participate in the physical activities to maintain their physical health. And because of this, because of the obesity rate increasing, they have a higher incidence of cancer, diabetes, and heart disease. So Vermont has a reputation for having really good health. It was named one of the healthiest state in 2019. But Orleans County fell behind in a lot of areas related to keeping up with the health. And because of that, I knew that this county needed more attention to keep up with the reputation of Vermont. And not only this, but managing obesity is important in preventing other diseases that can contribute to long-term health problems that can burden your personal health, or your personal life, and the health of a community. The goal of this program is to reduce the number of obesity cases among adults and children in Orleans County, Vermont. The goal statement: by 2024, the incidence of obesity in the Orleans County population will have decreased by 5%. So here's a pretty big list of the assets and stakeholders that are part of this program plan. There's a lot going on here, but it's important to point out the providers that are stakeholders. They are the patients and the families who are dealing with obesity, and so they need to deal with a weight management dietitian, and there's also the organizations that can help provide food to people who are dealing with food insecurity, like a church that has a food pantry. There's the food bank and the volunteers that contribute to this food pantry that help keep it alive. There are also like physical activity spaces that are important to help people who have obesity to get out there and exercise and move, because although nutrition is really important, physical activity also contributes to maintaining wellness and your weight. And then in terms of providing nutrition education so people know how to manage their weight, there are institutions like the school system, the health department, things like that, that provide educators to come in and educate people. Those are really important. So there's that. And an important part of financing is the USDA and Nutrition Services that have grant money that gives nutrition education and benefits for people who are poor and in need to both get access to food but know the information to have buy healthy food with these benefits. Here are the objectives for the program that are broken down into individual, health service, social factors, and policy, and they go from things that are pretty narrow on an individual level to really broad, better, more long-term. And I wanted to point out that the individual behaviors are things that nutrition educators can bring into schools to help children. That's through FNAP and the extension program within Orleans County. And then the health services focuses more on adults with the worksite wellness, but then there's also the public school by changing the school menus to help integrate more fruits and vegetables. With the social factors, we want to make sure that people are going outdoors more, so I'm encouraging things in the park that bring people outside, come together and work out together through like yoga. And then with the policy, we want to involve the Academy of Nutrition Dietetics to make a nutrition policy, make it more so that children have access to healthy food in public spaces like schools. And we want money, so FNEP has federal funding to have more advocacy, so that both children and adults are getting the nutrition education that they need to make healthy choices. So there are a number of different areas within intervention that would help meet program objectives, and that's in the area of nutrition education, physical activity, policies, advocacy, and more. And it's divided into qualitative and qualitative data. There were a number of evaluation tools used to make sure the objectives were met for things like obtaining nutrition education plans from the dietitians. So we had to keep communication online with them to make sure that they were meeting the deadline to create a plan that met the objectives of the program. Were they creating a nutrition education plan that would meet the objectives for the kids and the adults? And so we need to keep up with communication to document the progress. And then with things like the gardening activity and the yoga activity that was planned, there was a sign-up sheet involved, so that's the quantitative data, but there was the need to measure the space of the garden. That was also quantitative data, but then there was communication with the people who were managing the park or managing the garden, and that was qualitative data. And then with promoting policy, we had to use data to count the number of advocates involved, but we also had to communicate with those advocates and be aware of the progress towards the goal. And so documentation in the form of surveys and petitions were important, but also communication of the events and things that happened during them to get an idea of how well progress was being made in advocacy and policy making.